COVID-19 cases continues to grow across the nation. People, of course, remain on edge, wondering when we'll turn that corner. Well, joining us now to talk about the coronavirus pandemic is epidemiologist and Allegheny College professor Dr. Becky Dawson. Thank you so much for joining us tonight, Becky. I know you've been extremely busy. As we've seen the number of positive cases and deaths rise, are you satisfied with the Commonwealth and the country's response so far to the crisis?
Actually, I am. I'm really excited that all these words that we use in epidemiology, like social distancing and quarantine and social isolation, have actually become kind of part of our common vocabulary. So I'm really excited and proud that we've taken such drastic measures. This disease is extremely contagious. We know that it is very dangerous for older populations and people at high risk. So the fact that we're taking such extreme measures to keep our distance and stop the spread of the disease actually makes me really proud of our country and our state and our counties.
When you look at the cases that have reported positive in Erie County of the 5, they're all in that younger age range, I guess, when you look at a typical case of coronavirus, COVID-19. Do you think that the social distancing and the better, I guess, hygiene is helping then?
Well, I think that it's going to be a little while before we can see the impact of all of the extreme measures that we're all taking. So right now we're seeing disease pop up among people who were together before we started this really extreme social distancing. So I think it's going to be a little while, and we need to all be patient to see the results of all our behavior changes.
Well, yeah, and we've heard, though, too, obviously, we've had 2 days with no new cases. We don't want people to get complacent.
Exactly. We can't be complacent. So 2 days without cases could just be that, the labs are a little bit slower today, or that, they got a batch that weren't COVID-19 cases. So we need to be really, really diligent. If you look at what's happening in Italy and even in New York City, which is not that far away from us, we have a lot of reason to be concerned and a lot of reasons to really take these social distancing measures really seriously.
Well, and I'm quite surprised, and I don't know how you feel about it, but just coming into work today, it seems like there's still a lot of people out there driving around.
It does seem like there's a lot of people driving around, and I think we're all, not having ever lived through anything like this before, we are nervous, and so we're going to the grocery store and we're stocking up on things.
We're buying things we don't need at this point.
Right. There's no flour, no yeast, and no toilet paper right now. But I think we need to all take a pause and remember that this is new for all of us, and even in the places where we're seeing, these San Francisco, New York City, where people are being asked to shelter in place, even Allegheny County, you are allowed to get out and get your groceries. You are allowed to get out and get exercise. So I think taking a little bit of a step back and remembering that we are not asking you to stay in your home, but that we're asking you to distance yourself from others and maybe make fewer trips is really what's important right now.
Do you think that 2 weeks to self-quarantine is enough time?
So 2 weeks, if you've been exposed, so if you know that somebody that you have come in contact with has COVID-19, 2 weeks of quarantine so that to make sure that you don't have the disease or you don't start presenting symptoms and you're not spreading the disease while you're asymptomatic is absolutely positively the right amount of time, because we know that the incubation period, so the time from exposure to when you start seeing the symptoms of disease, is no more than 14 days. So 14 days quarantine, absolutely. In terms of our community isolation and kind of how the governor is working on a 2 week by 2 week schedule, I would anticipate that it's going to be extended a little bit longer, especially as we look at Italy and New York City as the explosion of cases is occurring right now.
Let's talk to, I know there's some myths you'd like to debunk, I guess, surrounding COVID-19. I can't even imagine in your field what you're getting with the phone calls we get in the newsroom. What would you like to dispel when it comes to some of those myths?
I think the first big myth is that, is there a treatment? And the answer is no. There is no treatment for COVID-19 right now. Doctors and nurses who are caring for people with the disease are trying different forms of treatment to help individuals who are suffering. However, you can't go home and take a lot of vitamin C, or my favorite, which is gargling with salt water will kill the virus. None of that is
so
going
that doesn't
to work.
No,
it doesn't work. Your best bet to not get the disease and not spread the disease to others is to stay away, to take these, not just suggestions, but these mandates to socially distance yourself very, very seriously. We need to be 6 feet away from people, and we need to be staying home as much as possible.
Let's talk about face masks, too, because that's another trend we're seeing on social media, people making face masks. Do they need to be the grade of N95, obviously for medical personnel, but do people need to wear face masks?
So if you are not sick right now, putting on a face mask is actually more dangerous than not wearing a face face masks. And the reason is that when you put on a face mask, you touch your face. So we are really trying to encourage people, you don't need to wear a face mask when you go to the grocery store. You don't need a face mask when you go out. However, we do need the N95 mask for our healthcare providers. And if you are sick, so if you start coughing and you have, whether it's influenza or COVID-19, we will probably ask you at the hospital or a clinic to put on a mask so that you're not coughing onto other people.
Epidemiologist Becky Dawson, we could talk to you for hours about this, and I am sure we will talk once again. We thank you so much for taking the time to join us tonight.
Thank you.
And we'll be right back.